All right, so the top 5 mistakes that I made are these. Number 1, hoping his leg would miraculously heal. It didn't heal, and it's highly unlikely that it'll happen to your dog. Mistake number 2, allowing him to go outside without his leash. It's a pain, I know. Your yard might be fenced in, and it's just so easy to open the door and let them out, isn't it? The problem is, when they're outside, they can run. And when they run, it just puts a ton of stress on that torn CCL. As much of a hassle as it is, get the leash on. You're going to need to do it if you choose surgery anyway. Get them used to going outside with a leash. Number 3, allowing him to jump or run, both inside and outside. Every once in a while, he would have a great day, everything would be good, he'd hardly be limping, and he would decide to have the zoomies. And I loved it. I mean, who doesn't love zoomies, right? He would be running around, and then maybe on that same day, I'd let him outside in the backyard, and he would see a squirrel, and he'd want to show the squirrel who was boss, and he'd chase after him and bark, and I liked seeing that, I have to admit, but what a foolish thing to do. He would also be in the house jumping on and off the bed, on and off the couch. And so every single time we allow our dog to jump or run, that straightening and then projecting outward movement of their knee is what loads up the knee joint with a ton of biomechanical force that stresses the heck out of that CCL. So if you are wise, you will limit jumping and running inside and outside the house. Mistake number 4 was a big one for me, and that was being tricked by a pain-free day or 2. If he was laying low for a couple days and I was doing a good job of monitoring his activity, of course, he would have some days where he was doing a little bit better. And what would I do? I'd let him run. So do you see how this cycle happened where it would be good days, I'd let him run and jump and play, limping days, and it would go on and on and on, and I had no idea. I just didn't know what I know now about CCL injury to not let that cycle happen. So definitely do not make that mistake. Mistake number 5 was, again, me getting tricked and thinking he was okay, and then thinking, he doesn't need all this medication in his system. I guess this is like the health nut in me, not wanting him to be on medications. And saying to myself, well, he seems to be doing better, so maybe I'll stop having him take the anti-inflammatory. And I mean, it's almost embarrassing to say because I know better than this. It just doesn't even make sense that I would do this. And not only did I make this decision, but I did it without consulting with his vet, the one who prescribed the medication. Had I done that, the vet would have said, no, you shouldn't do that, and here's why. But I did it myself. And so what happened, and you can guess what happened, he would have days where he was doing well, and then I decided to take him off the anti-inflammatory, and of course, the limping started back up. So those are my top 5 mistakes. Now that you know them, you will be less apt to making these mistakes yourself, and your dog will do better because of it. Now there's so much more to learn, so don't leave just yet. Click on the next video. I'll see you there. Now if you're liking these videos, I would love for you to be one of my channel VIPs. So what does that mean? You've already started actually just by watching this video. But if you would click the subscribe button and then click the little bell icon so that when I upload a new video, you'll be the first to know. And if you belong to any other dog-related groups, especially CCL injury groups, and you think this video would be helpful, please copy and share the link. Thanks for watching, and I'll see you next time.